or take 50 people like that, or 50 people with impingement. It doesn't have to be exactly like that. And let's randomize them to core strengthening, this type of stretching. I haven't seen papers like that. I know that what people are doing is stretching the muscles about the hip without running into the impingement, and then abdominal strengthening, lower back strengthening. Those are the main things that they're doing. Good question. I wish I had a better answer. If you look, and we look all the time, for published papers on rehabilitation of the patient with femoral acetabular impingement without having had surgery, there's not enough papers out there on that topic. That's a good question. In the back there. Well, that's a good question. Most of the patients, by the time they come to see me, have had years of symptoms. So it's taken them a couple years of struggling with this to get a diagnosis. But let's say, and occasionally I do have a patient who comes in, they've had 2 months of symptoms. I would say, take a season off, at least 3 or 4 months, work on this stretching, work on core strengthening, and then go back to your sport, see if it returns. This is assuming they haven't yet completely torn their labrum. If they don't have serious pathology, take 3 or 4 months off from your sport, stretch, core strengthening, come back to it and see if your symptoms return. It has a little bit to do with the extent of the deformity. You saw the person I chose for my video had severe impingement. I would tell them never to play hockey, never to do a sport with a lot of hip flexion without thinking about getting it corrected. But most patients are not that severe, and they could try that conservative period of time. It's amazing, and our young athletes sometimes now have almost no break. Right? They're playing sports all year. It's with the school, with the traveling team, and if they take a break, they're playing another sport. They need to take a break from any sport that really puts a strain on their hip for 3 or 4 months. And then some of those patients will go back and the symptoms just really aren't there that bad after that, and they can avoid it. So, but most patients who come to surgery have had a few years of symptoms. It's a good question. Thank you.
Would we be suggesting MRA versus MRI, especially when I'm referring a lot of family docs?
That's a really good question. What is the MRI that you should get? And not all MRIs are the same. Currently, if you're going to do a 1.5 Tesla, which is what most hospitals have, I would have an intra-articular injection of gadolinium. Sacred Heart went and bought the 3 Tesla MRI. So like in our office, we have a 1.5 MRI. But here in Eau Claire, I can send them to Sacred Heart, which has this 3 Tesla MRI. And with that strong a magnet, you don't need the gadolinium in the joint. But if you get a 1.5 reading that's negative, and they haven't had an intra-articular injection, there's still a possibility they have a labral tear, and I think that's what you're getting at. That's the thing to know about. A negative MRI with only a 1.5 magnet does not exclude a labral tear. And the other thing to realize from this is that we're all focused on labral tears because that was one of the earliest things that we understood. Some of these patients have bad impingement. They haven't yet torn their labrum, yet there's still a patient who needs to manage their impingement, needs treatment, so they can have no labral tear and yet it still suffer from impingement. Just like the shoulder, the rotator cuff may not be torn, but they may still have impingement in the shoulder. The same idea for the hip. So a negative MRI for the labral tear tells you at least I haven't torn my labrum, but it doesn't rule out the possibility that they have impingement. Yeah, absolutely. So these patients who have the deformity, if they have a sudden flexion of their hip, they're much more likely to tear the labrum than somebody with a hip that has more give to it. And while I see a lot of sports patients, I see patients who are in an auto accident, and if they get thrown way forward, they can flex their hip up dramatically and the 2 bones abut and can tear the labrum suddenly. So not all labral tears are chronic. Some of them are acute, and it can be a sudden tear from those 2 bones violently bumping into one another. And that could be a fall from a height or even just playing football, getting hit really hard, and a force could take you from normal labrum and a little bit of impingement to a complete labral tear suddenly. Yeah, good point. Right here.
You had mentioned that once you remove part of that femoral head of the bone and there's something from on a non-week period for 4 weeks. My question is if you got an active individual, say a high-level college football player trying to get in the NFL, what is their risk down the road of having a fracture occur because that part of that bone was removed?
That's a great question. To my knowledge, that hasn't been reported. In other words, I don't know of a single case of delayed femoral neck fracture. The few femoral neck fractures associated with the procedure have all been in that first few week period of time. The body has a kind of an enormous ability to rebuild bone. Bone is one of our best. If you're going to break something, break your bone, right? You have a problem because that can really heal, can really strengthen back up. I don't know. You can look at, Matt Burke. You can look at. There's a whole bunch of football players who've had it. You can watch them on any given Sunday. They seem to get beat up pretty bad and it hasn't broken. So I don't know of one who has broken their femur after having it properly rehabilitated and getting back 6 to 9 months later. So that's a good question, and if that happens, I imagine even perfectly normal femoral necks get broken, Bo Jackson, stuff like that. So eventually it might happen, but I haven't seen a high instance of that, or even one report that I can think of. Good question. Any other questions that we have? Do we have time for any more, Lynn, or are we wrapping up? Okay. All right. Thank you.